Hello, myself Dr. Sudeshna Mukherjee, consultant psychiatrist, sexologist and de-addiction specialist practicing in Siliguri. Let's talk in brief today about child behavioral issues. So what are the problems that children face and what are the kind of behaviors they do? We need to discuss about it because expression of children are very different than adults. So many times parents come to us with complaints like the child has suddenly started becoming hyperactive, not listening to teacher at school and the school complains something, or the child has become less attentive regarding studies, having a poor scholastic performance. Sometimes children also start verbally abusing, using slangs or something. Sometimes they refuse going to school, which is a big problem. School refusal is a big thing. So sometimes children depict such kind of behaviors. Okay, so we need to find out why a child is behaving like that, and sometimes it becomes very difficult because expression of children are different. So it is not that they can always tell you why they are behaving. Instead, they start either making a fuss or crying, behaving very angrily, throwing things, and they mostly project things to their near and dear ones. So mostly the parents get to see all these kind of behaviors. If they refuse school, it may indicate that there's something wrong going on in the school. There might be bullying or something, or the child may be feeling unsafe at school. So that thing also should be inquired about. And it is important firstly to not blame the child and try to be more connected with the child to know actually what is going on. You can always take help of your psychiatrist and psychologist for the same, because they know it professionally and there are techniques to ask the child, there are techniques to assess the child to know what is going on. And there could be a lot of problems the child is facing. Some children also have some kind of low IQ, and when they grow up and they go to school, they face a lot of bullying and they face that difficulty understanding subjects. So your child may have some learning disorder or low IQ also. That also can be assessed by psychiatric assessments. And also childhood depression or any other kind of like childhood disorders, if it is there in behavior or conduct, can be assessed by a psychiatrist. So if you feel your child is behaving something abnormal and it is not normal expression of his anger or his or her kind of behavior, do take help from a psychiatrist for assessment. Many of you fear that medicines will be started, but it is not that. We generally try to keep children with least medicines. So only if a child is very hyperactive or like very aggressive and he's hurting himself or those around him, and then we may need to give medicines. Or if the child has a particular psychiatric disorder per se, then we need to add medicines. Otherwise, most children are managed by behavior therapies and they do really well. So do keep a check and check with your psychiatrist. Thank you.